Treatment decisions for hemophilia management should be targeted toward the patient's goals, activity level, and bleeding history. We are now 5 years into the era of extended half-life factor replacement and at the advent of emicizumab prophylaxis, and these developments have greatly expanded our options for managing hemophilia. At the 2018 ASH meeting, Dr. Malik's studies describe increase in prophylaxis since introduction of extended half-life factor products and quantify real-world use of extended half-life factor products and impact on annual bleed rate. Now for a patient who participates in low to moderate risk activities 2 to 3 times per week, having more treatment options means that we have greater flexibility to find a regimen that fits his needs. The studies by Maureen Watt and Andreas Tide give us some insight to the personalization that patients can expect in the future. The first study suggests treatment regimens based on activity levels and schedules, and the second suggests an approach for optimizing patient dosing. Our patient should be congratulated for starting to tackle weight management through exercise. Obesity is a risk factor for joint disease, and by addressing overweight or obesity, he should have improved joint outcomes. Based on his bleeding, even with low to moderate risk activities, prophylaxis is indicated. Initiation of twice-weekly prophylaxis with an extended half-life factor is reasonable, and dosing and frequency could then be tailored based on PK studies and clinical response.